think in terms of how providers are addressing security and how aware they are, I think there's a lot that our respondents were doing right. They are, in large, hiring full-time staff to hire their information security environments. We found that 57% of respondents were hiring someone such as a chief information security officer or a chief security officer to have that as their full-time responsibility. We also found that respondents, by and large, were using a lot of the tools available to them in the marketplace. On average, of the tools that we surveyed for in our survey, we found that they were using at least 11 of those different tools, such as antivirus software, firewalls, data encryption. With regard to the motivators that are driving organizations, among our respondents, first of all, we found that 87% of healthcare respondents said that they had increased their information security posture in the past year. We wanted to understand what motivated them to increase their posture, and by and large, we found that things like their risk assessment and the findings of their risk assessment was a top motivator. We also found that some of the threats that were out there in the marketplace, phishing, antivirus and malware, and the threats of those things were also significant motivators. Respondents indicated an average level of confidence that they were going to be able to protect their IT infrastructure and detect security incidents. We found that many of our respondents indicated that the threats were coming, and there are new threats and there are emerging threats. So despite the fact that they are using a wide variety of information security technologies, the market is changing really fast and there's a lot to keep up with. So with regard to the tools that our respondents were using at their organizations, we found that a lot of the tools being used right now were kind of your standard technologies, firewalls, antivirus and malware, and technologies of that sort, and they were really widely used. As I mentioned earlier, respondents are using an average of 11 of the different technologies that we tested for in our research at their environment. So they're using a wide breadth of services. At the other end of the spectrum, we found that there are things such as researching the dark web and some other technologies that are just not finding a great deal of favor right now and are just not widely implemented. So with regard to staffing, we found again that about 57% of our respondents said that they had a full-time person in place at their organization. That might be a chief information security officer, which about 20% of respondents had in place. It might be just a chief security officer, which about 7% of our respondents had in place. Another 30% said that they had another full-time person in charge of their organization who might not have that specific title. With regard to the barriers that are in place that healthcare organizations are facing right now, the top two are lack of money and lack of resources. On one respect, that wasn't highly surprising to me because when we test in our other surveys for barriers, we often see lack of appropriate staff and lack of funding as top barriers. The one I found to be most interesting was that 42% of our respondents said that there were just new and emerging threats that were in place, and so they really had to be aware of these different things going on. Another finding that's connected to that is that many organizations are starting to think about information security as though their environment has already been penetrated. So they are thinking kind of outside of the four walls of their organization and making sure that they are coming at an information security posture from that perspective. So we found that about 67% of our respondents indicated that they had experienced a security incident in the recent past. The most frequently identified security incident was something that was caused by a negligent insider, so someone who may have just accessed a neighbor or a friend's medical records. But at the same time, when you looked at all the different items that we classified as an external threat, such as phishing or a hacker or a nation-state actor, 2/3 of those who had a security incident actually stated that it came from an external source. So I think that healthcare organizations really need to pay attention to both internal and external threats.